One person is dead and 2 others infected after Toronto Public Health declared a meningococcal disease outbreak. The affected individuals are all between 20 and 30 years old, and they were all born outside of Canada in countries that don't provide routine immunizations against the disease. Toronto Public Health is urging residents to check their records. Toronto typically sees 6 cases of invasive meningococcal disease each year, but Public Health has identified 3 cases in just 1 week, prompting them to declare an outbreak.
So to see 3 cases clustered in such a short time period of just one strain is unusual.
The cases were identified in July, and while Public Health hasn't been able to find a link between them, all 3 were confirmed to have the same rare strain. Symptoms of the disease include fever, aches, joint pain, headache, stiff neck, and sensitivity to light.
It's of concern because certainly untreated, it can be quite serious. It has a high case fatality rate, a high risk of death if you are infected and you're not treated promptly.
The disease is spread through close contact like saliva or spit and rarely affects older populations.
It seems to affect younger children and also teenagers.
Children in Toronto are routinely immunized against the disease when they are 1 and in grade 7. Toronto's grade 7 meningococcal vaccine campaign started in 2005 and included a catch-up for youth aged 15 to 19. This means a proportion, but not all, of people currently in their 30s who grew up in Toronto are vaccinated, which is why Public Health is recommending you check your records.
People can check with their healthcare provider. They can check with their parents. Their parents may have some information.
Public Health says the vaccine is highly effective. Those immunized would rarely develop symptoms.
Is there any concern that people might not be up to date on their vaccinations because of the pandemic?
Yes, that's possible as well. So, we would encourage people who may not have had the grade 7 shot because school was so disrupted during the pandemic to take advantage of our school catch-up campaign as well.
The vaccine is readily available for anyone up to 36 years of age, and Toronto Public Health is urging anyone who is experiencing symptoms or who hasn't been vaccinated to check in with a healthcare provider. For City News, I'm Tina Yazdani.